Good evening, everyone. Tonight, a local mom is back home, finally, ready to reunite with her whole family for the first time since spending the last 100 days fighting COVID. Think about that. She's been away from home almost a third of a year. It's a battle that started when she was pregnant and unvaccinated. Because of COVID, she was not conscious for the birth of her baby. In fact, she had to wait weeks before she finally held him, and nearly underwent a rare transplant procedure. So tonight, our Rich Nye kicks off our big story with the miraculous improvement she's making.
Autumn Carver walked out of Northwestern Memorial Hospital Wednesday breathing with her own lungs with no assistance. A remarkable recovery from a severe case of COVID-19 during pregnancy that sent her to the hospital 99 days ago and nearly destroyed her lungs.
I've always been strong-willed, determined. Glad I was able to use that to, fight to get healthy and save my life.
On August 27th, Autumn gave birth to her son at 33 weeks at Methodist Hospital. Huxley is healthy and 3 months old now. Mom was sedated on life support and did not meet or hold her newborn for more than 50 days. On October 24th, Autumn transferred to Northwestern Memorial Hospital in Chicago to prepare for a possible double lung transplant.
Thanks to the excellent care here and the miracle we experienced, my body started healing, and it was pretty incredible to hear the words from Dr. Barat that I don't think you need a lung transplant was amazing.
So I'm going to have you take some deep breaths for me.
Sure.
Dr. Ankit Barat is one of the top lung transplant surgeons in the country.
Based on what I hear from the stethoscope, I think your lungs are much more clear, much more healed up. This healing process will continue. I always jokingly say the less transplants that we have to do, the less stress that we have to face. It's always better to help patients get back to normal.
In 5 weeks in Chicago, Autumn made remarkable progress. Her exam before being released included a breathing test.
Exhale through the device as hard as you can.
She can talk, she can walk, she can breathe on her own. We're going to walk out of the hospital here in a little bit and go home, and I just don't have the words. I'm super, super excited and blessed and grateful.
Zach and Autumn are surprising their 2 daughters Thursday that Mom is home, and she can't wait to finally be mom to Huxley.
All of it, including the late night wake-ups and everything. Baby snuggles are the best, so just looking forward to that bonding time.
Autumn was not vaccinated against COVID-19 during her pregnancy. She asked Dr. Barat during her final checkup about getting the vaccine now. He advised her to get the shot as soon as possible.
A couple months ago, the CDC issued its strongest recommendation yet, urging pregnant people to get the COVID vaccine. Now, at the time, only about 31% were fully vaccinated. That's despite more than 125,000 cases among those who are pregnant. More than 22,000 ended up in the hospital, and 161 of them died. Local doctors say they've seen firsthand ICUs filling up with pregnant patients sick with COVID.
People are young and healthy. They're not 80 years old. They're not people who've lived these long lives and with complex medical conditions. They're just pregnant.
Doctors say the protection of the COVID vaccine far outweighs the risks for pregnant people or families trying to get pregnant, especially with the increased risk of an early birth or stillbirth among those who are unvaccinated.
The infection can cause preterm labor and then delivery. Sometimes the decision is made to deliver the baby early so that they can optimize the care for the mother. And when you're making the decision between a woman and her baby, it is heart-wrenching.
We have seen some vaccine hesitancy among those who are pregnant who saw misinformation online claiming that the shot can cause infertility. Our Verify team talked to doctors who say there is no evidence supporting that.
No, vaccines don't cause infertility. There's also no mechanism that would suggest that theoretically they could cause infertility.
You can see that full report right now on WTHR.com. And that wraps up tonight's big story.